Welcome, I'm Tafara Gadamu. A senior government official says infection rate has increased by well over 300% in the last 2 weeks alone. Coronavirus is real, it's here. But what does it mean? Have we failed to listen? My guest today, Dr. Tewabech Bishaw, a public health professional, is active in the discourse on COVID-19. A very warm welcome to the program.
Thank you. I'm very happy to be here.
COVID-19, this is making its presence felt in the Ethiopian public health landscape, as you definitely would agree, right?
Very true, yes.
As we speak, over 112,000 laboratory tests conducted since it was first reported in Ethiopia on March 11th of this year, of course. And then in the last 24 hours, tests conducted come to close to 3,000. So far, we have 12 people who died as a result of these COVID-19 complications. Is that something that's alarming, you think?
It's true, and it's very, very alarming and very concerning because it shows the speed of transmission in the country, and not only for now, but also it's indicative of a trend that it may continue moving within the community faster than we think.
But there are others who come up with a counter argument. They say, had it been that fast, it would have evolved into some kind of community transmission, which it is not. This as we speak.
Now we have community transmission because if you have noted the report from the minister when she reports her daily.
I mean, at an alarming rate.
It is alarming because over last week. For a period of 1 week, we have almost 500 or so cases. Prior to that, if you've noticed, it was 3 cases, 2 cases, no case, in the whole of March. And then in April, it starts gradually increasing until over about last week, when it started going in double digits, more stronger double digits, like 88, 137, 95, and so on and so forth. So this shows that the infection is transmitting within the community. Community transmission means that the virus is transmitting within the Ethiopian society, within the Ethiopian community, without any effect from external source. In the past, initially, when the epidemic was experienced in Ethiopia, it was imported cases. These cases were imported, and the history of the patient, the cases were investigated, were that they have had contact with infected persons from outside. So most of the story was outside. But now, Ethiopians who never traveled outside the country or who did not have anybody as their contact who has had exposure to an external a country outside Ethiopia are having the infection. So this means Ethiopians are transmitting the infection within Ethiopians, among Ethiopians, without any further relation to foreign.
But I've already qualified my question. I said at a devastating rate. Is it?
It is devastating because why it is devastating? Because when we look at the history of
look about 90. I mean, look at about 20 people. I mean, 12 people. Only 12 people died.
But the trend in other countries, it started like slowly progressing, and all of a sudden moving when the population, the virus has transmitted or moved from one person to the other.
Do you think it has?
It is moving, and I cannot say that it will be like tomorrow or the day after, but gradually we're going to see this massive increase in infections.
Do people in your profession have they made any predictions? When will the peak time be?
From what we hear, from what, there are predictions and there are also some scientific calculations, assumptions, and we are expecting the peak to be sometimes within the months of June, July, and then there may be some, because the pattern of the epidemic is that it has peaks, the first peak, then the second peak, and so on and so forth. So from what we have seen in other countries, the peak and also the trend in the country's transmission, that we will have, it's expected that the peak will be sometimes within June and July, and then there will be some downwards curve, and then it will peak again. This has something to do with herd, the herd. It's not herd immunity, but herd exposure. Today you have 10 people exposed, but nothing is happening. Then 20 people exposed, 30 people exposed, and from among these, the infection, you will also have the chance of exposing people who are more vulnerable and more susceptible with less immunity, and so it is expected that it's going to be high numbers, but we don't know how much. But in life, one person, one life is important enough. And also, we're looking at the history, Ethiopian history. I have had the opportunity to listen to a seminar that was organized by the Ministry of Higher Education and Sciences. And the session was on the story of Hidar Bashita. And the Hidar Bashita, also the pattern was more or less similar, where it started in April around Pasika, and then moved gradually.
All the way to November.
There was a dip, and then it picked up again. So, and that's also the trend, the epidemiological trend.
That's very interesting. But there are others who come up with a very solid argument saying that there is nothing to worry about. It's not going to be as infectious as we presumed earlier on.
In fact, mine is the reverse. We have to be concerned because taking care of the patients is not something that we are used to. That's something mild. It requires a lot of intensive planning, intensive healthcare facility, strong healthcare facility, well-trained human resources, and it's not a simple disease that could be undermined because it has challenged the best organized health services. In fact, one of the reasons that we attribute to, we're not saying this is the reason, but what is attributed to is Ethiopia started the closing of schools, closing of stay-home requests, and so on and so forth. And this might have, at the initial stage, downplayed the transmission. Now,
but we don't see mass death.
We don't see mass deaths.
So one good reason to get to that conclusion, which I stated earlier.
The reason is that when the people are caught, when we get the people are most of the people that are identified are from surveillance. So these are people that are not severely sick, but who have the virus, who are brought into quarantine places, and then immediately you do what needs to be done because the numbers also is manageable. So I think for any society in such kind of a massive global pandemic, it's always wise and better to err on the other side, because what do you gain by being careless? Why do you gain by being negligent of the importance of taking care of yourself to prevent and to protect from getting the infection by just saying, no, only 2 people died or only 5 people died, because we don't know, and the unpredictability of the virus is also one of the natures of the virus that's affecting globally. Plus, we also know that in society, there are a lot of people who are working with the virus. We don't know whether I am carrying the virus or you are carrying the virus because we look like we are normal people doing our day-to-day routines normally, but we transmit to those people who are susceptible of catching the virus. So because of this nature of the virus, its unpredictability, it's being new to science, because it changes its management and related things.
Let me follow your line of argument. Why surge in the number of infections, new infections then?
The reason why we have new cases is it's telling us that the virus is moving from people to people, from community to community, because we're not protecting ourselves, protecting the spread of the infection. Protection of the spread of the infection, as we have noted, the non-pharmaceutical interventions that, as they are known, is washing hands with soap that kills the virus, cleaning spaces with antiseptics, distancing from people because you don't know who the other person is, whether he's carrying or he or she is carrying the virus, and also wearing masks because this virus is carried through droplets. As we speak, as we sneeze, as we cough, droplets are spread in the air. So we know now that the virus can stay in the air for a longer period of time. It's not like once you sneeze, then the virus drops. No, it stays in the air. It stays on surfaces. It stays in the hand. So the virus is a notorious virus that has overpassed human imagination.
And all these things, all this information is publicly available. And actually people are telling this story. The Ministry of Health, other NGOs and everything are coming up with interesting public service announcements saying, please do this, please don't do that. Well, despite all that, people don't seem to listen. Is that what you're alluding to? Yeah,
people don't listen. People don't listen because they don't think that it will be them. So, no, I'm fine. I'm healthy. I'm strong. That's one feeling. And I will not be infected by the virus. That's one. Secondly, it's simple denial. Transmission is in the community. This virus is a notorious virus. We need to take care of ourselves, and not just take care of ourselves, but take care of the other person around us. But human nature sometimes is such that there is the denial factor. We are in that stage now, but we have to get out of that stage immediately.
How do you get out of that stage immediately? Do you think that there has to be, because we are in a state of emergency of sorts?
We are.
Is the enforcement part, is that missing, you think?
The state of emergency is declared. Yes, there is, like if you have seen China, if you've seen other places, they force people to go and get quarantined. Or the lockdown policies. But here, since the ministry started to talk about wearing masks and the importance of wearing masks, many people didn't bother to buy and wear masks because some people feel, no, I feel suffocated. No, this is creating all kinds of reasons not to wear a mask. Now, we heard that it is compulsory, it's mandatory that we have to wear a mask.
You either do that or stay at home.
Do that or stay home. And then even staying home, you're going to be harassed by people who know that you should wear a mask if you step out of your house to go and join other members of society. There is, yes, we have to have, sometimes it's not because there are human rights. It is your right to remain the way you want to remain. But when your right is going to affect somebody else, then government, who is the main duty bearer, has the responsibility to ensure the safety of the society. It's not you as an individual, but the whole society. So if you're not wearing a mask, it's going to affect society, the next person, and the next person affecting another person. Then the responsibility of the government is to protect its citizens, and that is why we need that enforcement. Because sometimes it also puzzles me why people know the consequences of their action is not going to be safe, but continue to do what they are doing. Because as we just said, they waited until it was mandatory to wear a mask.
That they started wearing.
They started wearing, and even now you feel that they are wearing masks just to please the police or not to be caught by somebody who is a law enforcement officer who is going to ask you to wear a mask.
So fast forward, what should be done, you think, if people are not...
Continue insisting, penalize people who are going to affect society, because we know from our recent experience, we were not wearing seatbelts. Seatbelts were taught over and over and over again in terms of their security and safety in the car. But people started wearing seatbelts once the traffic police started stopping them and penalizing them. Again, smoking in public spaces. People, were educated, taught, and so on and so forth. But until some enforcement was introduced, people didn't respond positively. So, as I have been saying, Tafarra, we have to insist. It's not waiting for the health workers to speak. You know about this. Everybody knows, most of the people know what needs to be done. So every one of us have to be policemen, so to speak, in terms of ensuring that, if you don't wear a mask, you're going to affect me. So I don't want to be affected because you're not wearing a mask. So we have to insist that people should wear a mask.
Do we have
enforce a mask?
Interesting point, because this must be something related to enforcement, to actually force people to do what they should do in order to be able to prevent this from happening, right?
Yes.
But also, this is going to need plenty of resources.
Yes, it is a resource-intense pandemic, not just on the health sector, but on many other sectors as well. Yes, the health sector have to redirect resources to procure equipment, supplies, and train human resources, engage them in these specific activities. And this, to some extent, has been an added burden on the sector. Not only that, another factor is that because the community is afraid of coming to the health facility, many of the other patients, mothers, are not attending the health facilities. So there are health workers, health facilities ready to attend to the general population, to mothers and children, and to other chronic patients, but they don't come to the facilities. So you are also wasting your facilities while people are hurting and suffering because of not being attended by health professionals. And in addition to that, the third aspect of the economic implications, I'm not an economist, as you know, but the implications is that people are staying home. People have been, because businesses have gone down, so people have been laid off from their jobs. Many industries, the entertainment industry and others, are completely now out of job. So these have economic implications directly and indirectly, in addition to the resources that the health sector needs to address the pandemic. So that is one of also the reasons why we have to intensify actions now, so that there is likelihood of slowing down the transmission in the community, and you start of thinking of reopening businesses, reopening activities, reopening life again. So it's dependent on our action of focusing on preventive activities, so that we ensure that the transmission in the communities is subsided enough so that reopening is justified.
Have you, in your long life as a public health professional, I'm sure you've run into pretty disastrous, at least localized ones, epidemics in Ethiopia. Cholera would be one. What was the experience like?
Yeah, when the first cholera epidemic, it was in the 60s. When it happened, the country was caught unaware.
And you were in Harar.
And I was in Harar. And if you remember, the epidemic was known to have moved from the Middle East via Djibouti. So Harar was one of the regions that was hardest hit.
Well, it was close to the border too.
Yeah. We have to mobilize the entire resources, universities, the military, the taxi drivers, everybody, so that first in communication and education, because once people are aware of the mode of transmission and protect themselves from getting the infection, then that would be step number one. But unfortunately in our societies, and the way cholera was transmitted at that time was that, through oral fecal transmission, and knowing our hygienic conditions, it was a disaster. So we had to spread the entire region with camps, with health workers, intravenous fluids, oral rehydration therapy, and so on, moving from it's neck-breaking movement of fast reaching of communities. So that way, although the damage, more people got infected, but it was also possible at that time to minimize deaths because of the entire national mobilization, because it was visible. People were getting sick. They come with vomiting and diarrhea, and you have to respond. But once you do the replacement of fluid and electrolyte, you know that people walk up and start walking to their home. But with COVID, that's not the situation. And also what is terrorizing is that the experience that we see in other countries, in Italy, in Spain, in New York and other places, unless we fight, we do our fight now to prevent from the infection from happening. It is devastating for us and for the entire population if the epidemic sets in at that scale. So again, over and over and over again, protect yourself, protect others. It is possible to do so. Like some of those countries, like Italy, they didn't realize that using those preventive measures were what they needed. So their kids were outside, in school, in kindergartens. When the kids came in with the infections, then grandmothers and the elderly were at home, so they couldn't stand the infection, and that's how the devastating.
Can you visualize for me the post-COVID-19 scenario in Ethiopia? It's not going to be the same again.
It will not be the same. We have to have robust health facilities. We have to have aware population that's aware, starting from kindergarten, on what needs to be done in terms of controlling the spread of transmission of infection. I think what we learned from the COVID epidemic in terms of the society is that we have to stand together, for one another. The health system should be a part of the entire development, economic, social, and other systems. So we are interconnected. The globe has shrunk. The mobility of people today, a major epidemic starts in one corner of the world. The entire world shakes. So we have to know about this and prepare ourselves so that we have a responsive system. And African governments have to join hands and have to strengthen their national health security. and work together. So the business, one of the critical business of the AU should be to ensure that the population, the African population, is healthy. It has access to affordable health, equitable health, and that the health of the entire population is achieved.
Well, thank you very much indeed, Dr. Tewabech, for joining me here to share your expertise as one of the leading public health professionals that we have in this country. Thank you very much indeed.
Thank you, Tafarra.